when they become available, and ensure that all 7.8 billion people who need vaccines in the world should, the COVID vaccines subsequently should have it. I think that is our position from the continent.
All right, thank you, Peter, for that question. We have another question coming in from Emmanuel, and Emmanuel essentially is asking about the situation in Tanzania, but you've already taken that. He has a part B. How much of a concern are the testing levels in the majority of African countries? Are there any significant new sources of testing kits that are emerging?
Yes, there are two significant sources of testing kits that are emerging. One is that we currently have a task force in Geneva that is working with several parties, including the World Bank, the Gates Foundation, UNICEF, UNITAID, Africa CDC, to unlock the Global Fund, to unlock that space and make sure that test kits are available to the continent. It's taking time to put that system in place, and you can imagine that this is never a straightforward process, but we are happy that we are beginning to see the light at the end of the tunnel. The second thing is that Africa CDC is aggressively putting in a platform that will allow countries to have access to testing, especially those that are produced by companies in China, as well as companies in Europe and elsewhere. So I think we are working on several fronts to unlock the testing front, to ease and the testing strategy. It is an integral part of the PAC strategy that we launch that will enable countries to have a predictable access to testing.
The next question is also about testing, and this time it's coming from Peter Mwai of BBC Reality Check. And Peter says, in the past week, we have seen some countries complaining about testing kits and medical consumables. For example, South Africa, which has been conducting many tests, was short of reagents and testing kits and facing backlogs. What would you say is the situation on the continent in terms of kits and consumables availability? Could these challenges affect the easing of lockdown measures?
That's a very good question, and we are fully aware of the situation in South Africa, and of course is related to the aggressive testing strategy they've conducted. And again, it ties to what I just explained earlier, that we as a continental body is working with several partners, relentlessly to make sure that we unlock the testing situation. South Africa has reached out to us. This coming weekend, we will be distributing extra tests, and we're hoping that that will unlock the situation. We have 500,000 tests as we speak that is being distributed at the airport now. Ethiopian Airlines will provide us with a distribution information so that by Monday, some of these challenges in many countries will begin to be resolved with the supply that we have standing at the airport and about to be distributed. With other commodities, it's clearly that the same challenge. We are struggling in context that the whole globe, the whole world is dealing with almost the same set of suppliers. So it's obvious that there will be gaps in commodities besides the diagnostic tests, and we'll continue to deal with that as the situation evolves. But overall, the access to these commodities and test kits have improved over the last couple of weeks.
We have another journalist who is online, and it's Mohamed Abu. He's the chief correspondent of the African Development Magazine in Accra, Ghana. Mohamed, are you able to talk to us? Hello, Mohamed. Mohamed? All right. Let's move on with questions coming through from WhatsApp. We have a question from Della Russell. In fact, we have a number from Della. Della says, in many countries, including Ghana, the progress of recovery seems to be slow, considering the rate of infection, which is rising each day. What could be accounting for this, and how is the Africa CDC helping member states by way of essential medicines to help in addressing the recovery challenge? So this is the first question. The second one is, what's Africa's vaccine solution, knowing the communities we rely on for essential medicines are also experiencing bigger challenges with the pandemic and therefore are unable to export vaccines to Africa?
So it's in terms of recovery, the low recovery, I'll be honest to say that I've not, we as Africa CDC have not seen the data from Ghana that says that their recovery is low or lower than other countries. But as you bring that to our attention, we will be more than happy to engage with the Ministry of Health of Ghana to understand what is the nature of the issue you are raising there. With respect to essential medicine, remember that PAC, again, which is partnership to accelerate COVID testing, is underpinned by 4 T's. One of those T's is treatment. So we are calling on partnerships to make sure that they have access to treatment or case management of COVID infection, but treatment as a whole, in a holistic way. I mean, if you all remember, one of the pillar of our response strategy is to avoid harm. And harm should include access to ongoing, to treatment, to ongoing endemic diseases like HIV, like malaria, like tuberculosis. We should always remember that during the West African Ebola outbreak, so many people died from Ebola than due to Ebola. So they died from Ebola because Ebola disrupted the flow of essential medication, and not necessarily because they were infected of Ebola. So I think we have to be very, very sure that in the PAC strategy, we are strongly encouraging the partnerships to ensure a smooth flow of essential medicine, including those that are critical for the vertical programs that I just mentioned. With respect to vaccines, there is really no known vaccine yet against COVID, so I cannot comment as to if countries in the West are exporting or not exporting vaccines to Africa. We don't have a vaccine yet against COVID-19.
Mohammed has come through on WhatsApp. Thank you very much, Mohammed. We couldn't get him on the live chat, but he's written his question down. And the question is, COVID-19 comes as an add-on to already existing impact of climate change on African economies. What mitigatory policy frameworks should African countries be considering?
That's a very, very good question. I think there's, Africa as a whole is signatory to the agreements that have been reached at the global level. I think it's called the Paris Agreement on climate change and other agreements that have been in place. So the key thing there is that we should, as a continent, be making sure that these agreements that have been made at the global level are actually implemented and follow through with the concepts that and resolutions that we agreed on those. So Africa cannot deal with climate change alone, but Africa has to be a catalytic in raising its voice and making sure that those commitments and agreements that have been reached previously are actually met.
Dini says that there is a general outcry that a trial vaccine will be tested in Africa first, and more, how can Africans be assured that the human testing will be safe and Africans will not be made guinea pigs?
Perhaps let me start with that, the last sentence there. I want to assure everybody that Africa will not be a guinea pig. Africans will not be used as guinea pigs. I think Africans have some of the best scientists. Africa has some of the best public health experts in the world, and this is not just being rhetoric. We know that during the West Africa Ebola outbreak, the research that was conducted there for vaccine trials was led by Africans. There's a CDC here, which is extremely competent and solid body, full of top public health experts, which is a resource for every member state to access if they approach concerning issues related to vaccine trials. So we are not longer at independence where we didn't have the capabilities and manpower. We have the infrastructure. We have the capable scientists that have proven that they can conduct life-saving clinical trials in multiple countries. In the Democratic Republic of Congo, scientists like Jacques Muyembe have been instrumental just in the recent past in conducting clinical trials for treatment of Ebola. That became a game changer and is currently a game changer in fighting the current outbreak in the DRC against Ebola outbreak. So conducting vaccines on the continent is not something that Africans are not used to doing. And we stand by all countries to coordinate that effort on behalf of the continent in close collaboration with the World Health Organization. And we will continue to be very vigilant to ensure that two things happen, that any vaccine trial that takes place on the continent is conducted based on the most ethical principles. It's also conducted based on the most scientifically proven principles. And also that there's clarity that there will be subsequent benefit to the continent in participating in these vaccines. Let me just say this, that we Africans don't want to be standby in research against this virus. We want to be fully engaged in the research against this virus in all dimensions, including clinical trials, including vaccines, and including innovative ways of creating diagnostics there. But we have to do that using the same norms and standards that we know and that the world knows and exist publicly through the World Health Organization websites and other websites.
I think we'll take two quick questions because we are quickly running out of time. The first one is from Della Russell, and she says, what has been the progress of work on the Africa CDC's rapid response team, which is supposed to conduct training for trained health personnel across the continent to better manage the pandemic?
That's a very good question, Della. As you recall, when we had this conversation a few weeks ago about the launching of PAC, as a critical component to that was our call to action to deploy 1 million community workers, not necessarily community healthcare workers, but community workers, similar to what South Africa is doing. South Africa has activated about 30,000 community workers. So Africa CDC, as you heard me in my introductory remarks, is beginning to deploy community workers in multiple countries, and we're also in the process of deploying over 60 epidemiologists across multiple countries, especially in West Africa. But the community worker piece is very important. We are building partnerships with the UNAIDS. We're building partnership with the International Federation of Red Cross, and we're building partnership with multiple groups to ensure that we start putting people in the countries, putting community workers that will support contact tracing in the countries as quickly as possible, especially in Cameroon, in Chad. In the coming weeks, these countries, Mali, Togo will already be, Sudan will already be feeling a presence there in terms of deployment of community workers and community healthcare workers.
Thank you so much. Our last question is a follow-up question from Mohammed. And he says, Africa is home to over 5,000 medicinal plants. A few have been scientifically investigated as of today. does the Africa CDC have a policy framework for supporting the carrying out of scientific investigations to establish the phytochemical and pharmacological properties into more African medicinal plants?
So that's a very good question. As you are all aware, Africa CDC is just 3.5 years old, so we continue to develop those policies, but also mindful that the World Health Organization has developed some of these policies and it suffices to adhere to them. We don't need to reinvent the wheel, but rather to use those policies or enforce those policies that already exist over the, and guidance and guidelines that already exist over the years. So I think we are very comfortable that we will continue to work side by side the World Health Organization to reinforce and advocate for some of this guidance.
All right. Thank you very much. That brings us to the end of our press conference for today. As always, it was a pleasure having you online joining us, and also to thank very much Dr. John for always being available to come and answer the questions that are coming from the media. I want just to go out by reminding you of the details on how you can ask your questions to this press conference. So you can do that via Blue Jeans, or you can also send them to our WhatsApp number, +251 945 502 310. We are live on air every Thursday at 11 o'clock East African time. For now, it's bye-bye from all of us.